Let's talk next about tricyclic antidepressants. They're not commonly prescribed as they used to be for depression. The SSRIs have taken over. But tricyclic antidepressants are still around. They are quite dangerous, a poisoning, and they will still be tested on board exams. Tricyclics kill primarily through two mechanisms. One, they cause seizures and status epilepticus, and two, they cause ventricular tachycardia. So let's look at a case. Here's a 28-year-old who took a bottle of TCAs, that's tricyclic antidepressants, and some benzodiazepines an hour ago. The patient is stuporous. They're going to give you some word to express that the patient has severe CNS depression. The respiratory rate is low, 7, and the EKG shows a wide QRS. What do you want to do next? Is flumazenil a right answer? Remember, that's the drug that reverses benzodiazepine? The answer is no. Do not give flumazenil, right? Because, number one, the patient might be a benzodiazepine-dependent person to begin with, and that would induce seizures to reverse it. Secondly, tricyclic antidepressants cause seizures. And what's the treatment for seizures? Benzodiazepine. That's right. So I'm actually kind of glad this person's self-medicated with benzodiazepine, and the last thing I want to do is reverse it. How about polyethylene glycol? Go Lightly is the trade name. That's the stuff that flushes out your intestines quickly. This is the thing that you drink prior to colonoscopy, so all the fecal matter is removed from the colon and intestine. That won't be of use here either, because this is not a sustained release preparation, enteric-coated preparation, and all the TCA will be absorbed. Who wants to give charcoal? Now, if they say, who wants to give charcoal, that's the right answer. If they say, who wants to give charcoal by mouth, PO, in this particular case, it's not a right answer, because the patient's comatose or stuporous or lethargic. Do you want to give comatose or lethargic people something to drink by mouth? The answer is no, they'll aspirate. So in this particular case, you want to intubate, protect their airway, then put down an E-wall tube because it's less than an hour. It's only an hour since they ingested. Remove the rest of the pills by suction, and then put charcoal down that oral gastric hose, down that E-wall tube. Right? That's what you want to do for this person. In addition, you do want to give IV bicarbonate. Why? The IV bicarbonate for tricyclics is not to speed elimination, as it is with aspirin or phenobarb. The IV bicarb here is cardioprotective. The indication is the wide QRS. As soon as you give the bicarb through the IV, it's really neat. On the monitor, you see the QRS duration shrink back to normal, thus lessening the chance of developing fatal tachyarrhythmia. Okay? That's tricyclics. Now you know how to pass the tricyclic question.